So I really appreciate everything you do every single day. And I know that the stresses you're under, lots of COVID is back. The ERs are full because the regular patients last time they didn't show up. This time they're showing up. So now we got regular patients plus the COVID. So I know it's really stressful and it's a hard time. There's long waits, and I really appreciate everything you're doing. So let me just give you a little bit where we're at on the vaccines and monoclonal antibodies. There's been some good new stuff. I'm going to start off with some of the common myths, rumors, and fears of this thing that I've heard for the folks that have been unvaccinated. And one is, and keep in mind, we've had this vaccine out now a long time. Hundreds of millions of people have had this vaccine now, and so in light of that, we're going to go over some of these things that people were worried about now that we've had some time pass and we can see if there's any issues. So one I got a lot was, I'm worried that the vaccine might change my DNA. This was a big one, that the vaccine could affect my fertility. And I've heard that both for men and women, they're worried about that, or it might affect the baby in a woman. I'm afraid of getting COVID from the vaccine. And I heard there were nanotrackers in the vaccine, which is my absolute favorite of all times of the various things. And then I had COVID already, so I don't need the vaccine. And, that's actually partly true. And we're going to talk about what the limitations of that immunity is. So first, about the DNA thing. This, and for those of you that don't know, in addition to emergency medicine EMS, when I went to college, I did biochemistry. So I actually did recombinant DNA technology when that was a new topic. I hate to date myself, but I do know this stuff. RNA is not DNA. DNA is in the nucleus, which is like the green zone in one of these war zone areas. It's super highly protected, and DNA is super tough, long-lasting molecule, which is why years after a crime, you can still find DNA. RNA, on the other hand, that's like the wimpy little cousin. It's single strand. The thing will dissolve on its own, let alone it'll get attacked by the cell and be destroyed. So what we're doing here is injecting with the messenger RNA vaccines, you're getting this messenger RNA, which if we just injected that alone, it wouldn't even get into your cells, it would be destroyed. It has to be protected and carried in by this basically a little force field barrier called a lipid nanoparticle, which is basically a little ball of fat, and the messenger RNA molecules go inside that. Otherwise, messenger RNA would never have a chance to get inside your cell. Once it get into your cell, that thing's really short-lived. It lives long enough to tell one of the protein making machinery in your cell to make the spike protein. And that's it. That's all it does. And then it dies off and it's gone. There's no chance for it to get into the nucleus, and therefore there's no chance for it to change your DNA. So it does one and only one thing, which is tell the cell how to make the spike protein, and then it's gone and it doesn't live on anymore. So that's really not an issue. Now, how about this one? It affects fertility and pregnancy. And this one is a problem because we're seeing a lot of women die or have bad outcomes, and even fetuses have bad outcomes because they did not get vaccinated. COVID-19 definitely causes pregnant women to do worse than the general population. Pregnancy is clearly a risk factor for bad outcome. And when you look at the folks that got vaccinated, and we just had a bunch of studies come out, there was no difference in all the baseline things that go wrong with pregnancy. And we know, pregnancy itself is a dangerous thing. You could have maternal problems, you could have blood clots, you could have fetal problems, you could have spontaneous abortions, or what we call miscarriages. You could have all sorts of stuff. Well, we know what the normal rate, everyday rate of all those things are, and after looking at thousands of people who are pregnant, there's no change. It's the same as it was before. It's as if the vaccine was never given. They're exact same percentage, no statistical difference whatsoever. The American College of Obstetrics and Gynecology, basically the docs that specialize in this, they initially came out with a statement that we think pregnant women, we think that the benefits outweigh the risk. But now this is what they say. It encourages its members to enthusiastically recommend the vaccine to their patients. That's a pretty powerful statement there. So bottom line is, it looks like it's safe in pregnancy, and the benefits clearly outweigh the risks. So how about you can get COVID from the vaccine? Not a chance. Like I said, it's just one little messenger RNA thing. It makes one of the proteins. The virus has multiple proteins and lots of different, a whole lot more RNA in it than this one little tiny strip. So there's no way you can get the virus from this thing. Not a chance. Oh, to go back to it though, what you do get from it though, it's designed to turn on your immune system. All vaccines do this. When it turns on your immune system gives you a fever, achiness, feeling tired. That's your immune system coming on. Now I
Like you locked up there, Doc.
As an infection, because typically it turns on when you a bunch of things. And back to my favorite one is the nano trackers are in the vaccine. I like the phone you are, but can listen to your conversations and can hijack your camera and actually see what's going on where you are. So if there was some big dark conspiracy to put nano trackers in somebody, this would be a big waste of time, because you already voluntarily take something around with you that is a whole lot more than just tracking you, because they can listen to you and watch you as well. So how about this? I had COVID, so now I don't need the vaccine. There's some partial truth to that. You do get some element of natural immunity, but we've always known that natural immunity is not as robust as the immunity you get from the vaccines. In fact, they did a study just came out in Tennessee. We know this virus is slowly changing, right? So the virus we got right now is not the same virus that we started with. It's already mutated a little bit, kind of like the flu. Now, the flu mutates a whole lot every year to the point that you need a whole brand new shot each year. This one, while that's similar, it doesn't mutate anywhere nearly as fast, which is why the original shot still gives you some protection against this thing, but just not as strong as it was in the beginning, because it's slightly different now. But they did a study in Tennessee that showed that if you got COVID and you recovered, and then half of those folks went on to get the vaccine and the other half did not get the vaccine, it showed that if you did not get the vaccine, you were 2.5 times more likely to catch COVID again. Because again, what you might be immune to in the beginning is now a different variant. And now you're getting a slightly different flavor of virus. So you might not be fully immune to it. And it looks like, yeah, the vaccine actually gives you 2.5 times less risk of getting it again. But it's not to say there's no natural immunity. And if you were to get infected again, you would likely have a much milder case. No guarantee on that, but since there is some immunity there. So how about putting it all together here? I don't know why there's so much hesitancy to this vaccine. I mean, we've had vaccines for forever, right? Even the smallpox vaccine. Many of you are too young to have even needed that, but some of us old folks, we've had that thing. But there's a polio vaccine, the MMR vaccine, which is measles, mumps, rubella, tetanus vaccine, influenza vaccine, hepatitis B. I mean, we've had vaccines all along. There's really no difference in the basic thing you're trying to do with a vaccine. The techniques have slowly been modified over the years, and I'm not sure that's a bad thing. I mean, if you have to cross the Atlantic, you want to do it in the Charles Lindbergh airplane, or you want to do it in a modern jet. So new is not necessarily bad. And I understand when it's brand new, you don't necessarily want to be the first one. But now we've literally got from the original studies, more than a year's worth of data from the folks that went to the original studies, and we've got hundreds of millions of people worldwide that have these things, and it's looking really, really safe. Now, that's not to say there are not lightning strikes. There is no medical thing ever created that doesn't have some downside. But when you look at the risk of what COVID can do to you versus the risk of what the vaccine can do to you, you have to do for yourself kind of a risk-benefit analysis. For me, I think it's clearly in favor of get the vaccine is the best way to prevent yourself from having a severe outcome, hospitalization, and death. Now, there's definitely some breakthrough infection. The breakthrough infections tend to be mild, and the vaccines do seem to be holding up really well as far as still preventing hospitalization and death. So it's still clearly our best tool for preventing that stuff. But the reason why you're seeing them talk about masks and all this stuff and can you catch it or not is because even vaccinated, you can get COVID. I know a lot of people that are fully vaccinated that got COVID, but not a single one of them ended up on a ventilator or even in the hospital. They all had some mild stuff. So this shows the hospitalization data in San Diego. And you see on the right, those of the people admitted for COVID, man, it's almost all not vaccinated people. So you see that the fully vaccinated, when they end up going to the hospital, they tend to be the people that, they're organ transplant or they're on immunosuppressive drugs. I mean, this vaccine does a hell of a job of keeping you out of the hospital and preventing those bad stuff. So it's clearly working. The stats in Florida are looking just like what I put up on the screen here. So the thing here is COVID, we're not going to get to herd immunity anytime soon. The herd immunity is a function of how contagious the virus is. Now, if you look at Epstein-Barr virus, that's basically the virus that causes mononucleosis. And we tested your antibodies, see where you're exposed to that thing. It's well over 90% of the adults in this country have that. That's because it's super contagious. So you're not going to get out of this thing. You're not going to get out of this thing without getting infected with Epstein-Barr. Well, SARS did not start off that contagious, but the Delta variant, that's where we're at now. So we're literally at the point where you are going to be choosing vaccine or disease, because now the Delta variant has mutated to the point that it's so much more sticky to the cells. The original virus, one person on average would infect maybe 2 people, but now one person infects on average 8 people. So what that means is you got to get to at least like 90% range of people to have immunity before this thing's going to stop. So now it's literally the only way to get immunity is get infected or get the vaccine. So it's really your choice, but that's what it is. But when you look at the risks, if you get the vaccine, you have an 8-fold reduction in having disease. That means, cough, runny nose, whatever, blah, blah, that type of stuff. It's not necessarily bad stuff. So 8 times less that you're going to get any symptoms at all. So we know there's vaccine breakthrough, and that's what's causing that little 21 at the bottom there. Those folks tend to be pretty mild. But what we really care about is the hospitalizations and the death. And you see are 25 times less likely to end up in the hospital and 25 times less likely to die if you got the vaccine versus being unvaccinated. So clearly, it drastically reduces your risk if you get the vaccine. So Delta variant, is it more dangerous? I mean, it's clearly more contagious, but maybe it's even more dangerous. There's some stuff we don't really know for sure, but there's definitely some studies out of Canada, Singapore, and Scotland that show it's more hospitalizations, more oxygen, stuff like that, more death even. So it's not fully known, but this is clearly this latest uptick. You've heard this term is a pandemic of the unvaccinated, and man, the stats are proving that to be true. Now, if you end up in the hospital as a fully vaccinated person, it's generally because you got some kind of underlying thing that made the vaccine not work so well on you. Now, this shows that the vaccine is not working as well as far as symptoms. Now, the Israel data is great. So here's confirmed infection. Remember, it used to be 95%. Now we're down to 64%. Having symptoms, it's down to 64%. But look at this, hospitalization or death. We're still way up there, even on Delta at 93%. So this thing's still rocking it for the bad stuff. So here's a summary. Delta, bad news, highly contagious, possibly more severe. Breakthrough infections are likely, but they're mild. But if you do get that breakthrough infection, unlike the old strain, you're probably contagious even as a vaccinated person. The vaccines are still, no question though, the best prevention we've got to prevent you from having severe disease, hospitalization, and death. But herd immunity, we're not getting there anytime soon, folks. So you really got to make that decision. Now, I've treated thousands and tens of thousands of patients during my career, and I tell people what I think is the best option. I've always told them what I think is the best treatment. But I firmly believe if you're going to put something in your body, you're going to take a medication, it is your choice. I'm not telling you must. I'm just trying to give you the facts, and you make your own decision here. Because like I said before, there's nothing in medicine that has zero risk. The risk from vaccines is extremely low. But you've seen the reports on the news. Every once in a while, there's a lightning strike and somebody has a bad outcome from this thing. The odds of having a bad outcome of the vaccine is much, much, much less than the odds of a bad outcome from getting the disease. Now, we know lots of people that got the disease and they did just fine. But there's way, way more many people that got the vaccine and did just fine than got the disease and did just fine. When you look at that head-to-head comparison, clearly the safety is on the vaccine side of things. But the choice is yours. You guys got to make that call. Now, I really want to talk about monoclonal antibodies before I turn it over to questions, because this is huge. This has been like the best kept secret, unfortunately, during this pandemic. This is basically treatment. Now, I was talking about prevention before. The vaccine, that prevents you from getting sick, but it can take up to 6 weeks for your body to develop that protection. But let's say you get infected today or exposed today. Now, vaccines aren't going to help you, right? They're going to take 6 weeks for the cavalry to arrive with a vaccine. That's too late for you. So what can we do today is these monoclonal antibodies. And there's 3 of them that target the vaccine, 3 of them rather that target the virus specifically. One of them, unfortunately, Delta's resistant to. So that one's out. We're not even using that one anymore. The other one doesn't have quite the same flexibility in terms of being free for the patients or being able to give it subcutaneously, et cetera. But this last one is the Regeneron, and that's what we're setting up around the state. You may have seen the governor on the news talking about this thing. So we are setting up these sites where, we're removing all the red tape. You don't need to see a doctor. You don't need a prescription. You just got to go onto the website, and the website is patientportalfl.com. You go to that and you sign up. If you've been exposed and you've got risk factors, you go in and get one of these shots, and it decreases your chance of catching COVID by 82%. Or let's say you already caught COVID, and whether you're vaccinated and you got risk factors, so you're worried that, you know what, I know I'm vaccinated, but I got the disease and I got diabetes, I'm overweight, whatever you got, and you're worried you might have a bad outcome. Or let's say you're one of those folks that chose not to get vaccinated, and hey, now you got the disease. What are you going to do? You go in and get one of these things, these shots, again, at one of these sites we're setting up around the state, reduces your risk of death and hospitalization in high-risk people by 70%. Really, the study wasn't done on everybody. It was done on high-risk people. It reduces your risk for death and hospitalization by 70%. But here's the key. Like everything else in medicine, early is better than late. You don't want somebody to go try to cure cancer when it's stage 4. You want to do it when it's stage 1. Same thing here. This stuff works when you give it early. If you wait to the point that you need to go to the hospital, this stuff's not for you anymore. Now you've basically rolled the dice, and we're going to hope you're going to do okay. Well, you've taken away your best tool to make yourself good. So you really want to get this while it's mild or moderate. Don't take a wait and see, I'll get it if I get bad, because it doesn't work when you're bad. It's too late by then. You got to take it when it's mild or moderate. So that's the end of it. I'm going to turn it back over to you, Sean, and we can answer some questions if you like.
Sure. So I got the first question on here. Someone it's a 34-year-old got a vaccine on August 2nd, and they're diagnosed with COVID on August 10th. Should they get the second dose, and what is the time frame to get the shot?
So if you got COVID right now, go get the Regeneron monoclonal antibodies before you get bad if you've got risk factors. So just go to patientportalfl.com and get yourself those antibodies. It's like basically taking an antibiotic for pneumonia, right? We weren't really using it as much as we needed to be. This can protect you because that first shot you got, that's not protecting you yet. So you got no protection from that first shot on August 2nd, maybe a little bit, but not enough. So if you have underlying risk factors, diabetes, overweight, heart disease, lung disease, whatever, there's a long list of them, then go ahead and get that. Now, once you get that Regeneron, though, you have to delay the second shot, because what the Regeneron is, let me back up a second. When we give you a vaccine, we're trying to teach your body to make antibodies, and that will create an unlimited supply of antibodies. It's something we call active immunity. Your body is actively making antibodies, but it takes, like I said, up to 6 weeks to build that up. When we give you Regeneron, it's antibodies also, but it's called passive immunity. We're giving you an external dose of antibodies, and that's going to give you immediate protection from the virus, but it's going to wear off. Because your body's not making it. This is an external source. So go get those antibodies, but you have to wait for them to come out of your system, though. Otherwise, the vaccine might not work, because those antibodies are going to wipe out all the spike proteins in your body. So your immune system won't get to see the spike protein that it needs to learn. So you got to wait for it to get out of your system. It'll give you good immunity for about a month, maybe 2 months. And by the end of the 3rd month, it should be out of your system. You can get that second shot.
Got it. So we're saying 3 months in between infection and the vaccine. Or is that for the monoclonal antibodies?
It's 3 months if you get the monoclonal antibodies. Okay. If you're like a young guy, you're healthy, you got no risk factors, you think you're gonna do just fine, then you can just wait it out. And we do know a lot of people do quite well with COVID. In which case, your second shot needs to be delayed to only till the point that you're over COVID, which generally takes 10, 14 day range. So the criteria is you've got to be at least 10 days since the symptoms started. You've got to be feeling better, and you've got to be at least 24 hours where you had no fevers despite not taking any fever meds. Once you reach that, you're ready to get the second shot, assuming enough time has passed. Because for Pfizer, it's got to be at least 3 weeks between shots, and for Moderna, it's got to be at least 4 weeks between shots. So if after your symptoms are calming down and you meet that criteria, you can go get the second shot. You don't have to delay it, unless you get the Regeneron. Then you got to delay it by 90 days.
Understood. So once you receive the monoclonal antibodies, can you do that more than once? How often? How many times can you do that? Is there a limit on that?
Yeah, so it is not a substitute for the vaccine, because the vaccine is the only thing that's going to give you that kind of longer term immunity. But the answer is yes. If you are somebody who has not been vaccinated and you're in the midst of very high community spread like we got right now, and you either get exposed to COVID or you're going to continue to get exposed to COVID, or you even come down with COVID, yeah, you can not only get it now, you would get a full dose now, and you would get a half a dose every 4 weeks until this thing's not in the community so much anymore, and then you can go get your vaccine after the antibodies wear out of your system. Again, you got that 90-day time frame. You got to wait for it to get out of your system. Now, understand, while you could do that, we're not really well set up for that. So don't be thinking you're just going to be taking shots for forever. This COVID thing's not going away anytime soon. I mean, this thing's going to be here for years. I mean, it's here. It's in humans. So this idea that it's going to go away, I'm sorry to tell you, you have to wrap your brain around it. It's not going away. I think hopefully it'll get better and better as more and more people get immune, but you're not going to be able to walk your way through this pandemic by getting just the Regeneron. So, but it can get you over the hump to the point where it's a little safer to get the vaccine.
Okay, gotcha. Okay, so what do you think is the time frame for the booster shots? I know we're talking, 8 months that they're talking. So can you talk a little bit about that?
I'm not entirely sure on that yet because, like I said, the vaccines, other than for the folks that have a lot of risk factors, and I would say if you're a person with a lot of risk factors or you're immunosuppressed, you should really think in booster. But if you're not, what are we trying to protect? It's relatively mild illness, even if you do have a breakthrough infection, unless you have risk factors or immunosuppressed. So I'm still waiting to see the data on that. I'm not saying I wouldn't take it, but I haven't seen a lot of data on it yet, other than clear cut. If you are in that high risk / immunosuppressed category, yeah, I think you should be getting that third shot. And they are saying 8 months after your second shot, you should get a third shot. Now, this is still new, so things may change from what I'm telling you, but that's the news I'm seeing so far. So definitely in the people immunosuppressed, which I would say if you're really elderly, you're by definition, you've got a weak immune system. But if you're on certain medications like prednisone or some of these other immunosuppressants, if you're organ transplant, you're on chemotherapy, et cetera, all of those are things that you would want to get a third shot on. Young and healthy, I need to know more before I can tell you about it. But it looks like they're leaning towards, the FDA has not weighed in on it yet, by the way. The CDC says maybe third shot for everybody, but I haven't seen the FDA weigh in on it yet, and I'm still waiting to see what's the data behind the rest that them making that decision. So I'm not sure. I definitely agree for the other group, though, the high-risk group.
Okay. Understood. I have a question here. What are the major differences between the J&J, Moderna, and Pfizer vaccines?
Yeah, Moderna and Pfizer are nearly identical. So those are both messenger RNA vaccines, both outstanding. And the reason why they're nearly identical is because the two scientists that work side by side to crack the code here, one went to Moderna and the other went to Pfizer, which is why they're so similar. There are some reports that the Moderna one seemed to be doing a little better against. Sorry, just kind of mute yourself there.
Yeah.
Yeah, so there are some reports that the Moderna might do a little better against Delta, but those are not completely peer reviewed yet. So we have to get the smart statisticians to go in there and see if that's a real deal or not. The Johnson & Johnson one is that's actually a virus. The messenger RNA ones, that's made in a big basically giant pot. It's a big chemical reaction that humans make that thing in. Whereas the Johnson & Johnson, they've taken a sort of a weak virus called an adenovirus that generally causes colds in people. And they do genetic manipulation so that in addition to being an adenovirus, it's an adenovirus that has a spike protein on it. So it doesn't use the spike protein, but it teaches your body to defend itself against the spike protein. So the Johnson & Johnson is a single shot, one and done, which is kind of nice. It also looks like it's doing a decent job at protection against hospitalization and death. It did not, at least in the beginning of the pandemic, it didn't seem to have as much protection against the more mild symptoms. But now even the Pfizer doesn't have that great against the mild symptoms either. I haven't seen a whole lot of later data on how it's holding up against Delta compared to as much I've seen from Pfizer, because a lot of that data comes from Israel, where Pfizer's been like the number one shot. So we're getting a lot of good data out of there. So I have a little less of the statistical analysis on the Johnson & Johnson. All three of the vaccines are very good. All three are doing a job at keeping you out of the hospital and keeping you alive. And then, of course, if you do get sick, I really want you guys to get that in your head. If you do get sick, keep that Regeneron idea in the back of your head there. Don't let somebody just turn you away from the ER and say, "Oh, come back if you get worse." Because if you get worse, it's too late for the Regeneron. Make sure you say, if you're not sick enough to be in the hospital, your next word is, "All right, where's this Regeneron stuff I can go get?" And then go get that especially if you're high risk.
Okay. Have another question here. What are the ages that can get Regeneron?
Yeah, same as the vaccines, 12 and older.
Okay, gotcha. I've also heard people talking about, when the boosters come out, since Moderna seems to be doing a little bit better in some people's opinion, that they're talking about getting Moderna for the booster as opposed to Pfizer. Is there any issue with mixing the RNA vaccines?
Yeah, it's not officially recommended. They recommend you get the same flavor each time, but I can tell you, with the millions and millions of shots we've done, there's been all sorts of times that by mistake, or maybe not by so much by mistake, people have mixed and matched Pfizer, Moderna, and there doesn't seem to be any safety issues with it. Okay. So while I can't give you like robust studies on how well does that do, people have already done that between shot number 1 and shot number 2, and they're really similar. So there's actually a technique. It's called heterologous vaccination, where you purposefully take 2 different flavors of a vaccine, hoping that you're going to get a bunch of different shapes of antibodies, because maybe the 2 spike proteins from the 2 companies are a little bit different, so you get a little more broad protection. There's some theories behind that. They have mixed and matched on purpose and in a study between AstraZeneca, which is very, very much like Johnson & Johnson, and Pfizer, and the results were really good. It was safe, and they got really good immunity from that. How it would be with Moderna and Pfizer, I don't know. It has not really been studied to my knowledge.
Gotcha. All right, next question. When is the state getting more J&J?
Don't know the answer. We got asked that the other day, and I don't know the answer. I'm not on that side of the house, on the logistics side, so sorry, can't tell you.
Okay.
But I'm pretty sure we're out of it. Other than the stocks that are currently here, I'm pretty sure that a lot of the places have run out. You may still be able to find it somewhere in the state at one of the pharmacies, but I don't know.
Gotcha. Any information on the Lambda strain?
I was hoping to hear more on Eagles, but I didn't hear a whole lot about it this last week. So Lambda is, we Alpha, we got Beta, we got Delta going on right now. So there's all these Gamma. So they're, I don't know when we're going to run out of Greek letters, but these are just all the various, they label the strains with the name. And right now Delta is the one we got to worry about because that is the predominant strain in the United States. But that's an astute question to say, hey, there's this Lambda thing on the horizon. I don't know enough about it yet, but I can tell you in general, the way that a strain takes hold is because it's survival of the fittest. Whichever strain is the best at being transmitted and infecting lots and lots of people is the one that will survive and become the predominant strain. Like Delta, for example, one person infects 8, like I said, whereas the original 1 infected 2. So clearly you can see how Delta could outrace the original one. So if Lambda turns out to be like that, then yeah, we'll see Lambda take over, but I don't know yet.
Okay. How long after recovering from COVID can you expect to have antibodies?
Yeah, it's a great question. You could start seeing the beginning of antibodies on day 7, as early as day 7 while you're still sick. Although some people that you don't really start seeing it till up to a few weeks afterwards. But it's just like the vaccines. When you look at the vaccines, day 13 or so after the first shot is when you really start seeing a bunch of antibodies. And I would imagine it's very similar with most infections. It takes a week to a couple of weeks to start seeing that rise, but then it'll continue to rise over time because what's happening is the cells are copying themselves. They are cloning themselves. So when you take a specific cell and it clones itself a lot, that's called a monoclone or monoclonal antibodies. So it's a single flavor of antibodies. That's what monoclonal antibodies come from. But you got lots and lots of cells doing this, but it takes a while for them to copy themselves thousands of times. And then, they're little antibody factories. So they copy themselves thousands of times, and that's how it ramps up the production of antibodies.
Okay. And that generally, is that still the same where you'll have antibodies for about 3 months from a natural infection-ish?
It looks like the natural immunity definitely lasts at least 6 months.
6 months.
Is the latest, yeah, at least 6 and counting. It does like for most things, it does seem to slowly wane over time, just like the vaccine. So it gets weaker over time. But understand, we don't fight infections just with antibodies. We also fight them with T cells. T cells, memory T cells are very important, and we saw after SARS-1, and this is SARS-2. It's very similar. It's over 70% genetically identical virus. We saw people a decade later, it still had good T cells, which means they would have maybe not as robust immunity as in the beginning, but they still got some immunity there.
Sure. Okay. I have a question on here about when all the vaccines will receive full FDA approval.
I'm sorry, say that last one again. I was trying to do two things at the same time. I'm not good at that.
No problem.
FDA approval?
Yeah, FDA approval for the vaccines.
Your guess is as good as mine. I've been hearing in the next few weeks for a few months now, so I don't know. I know that they've got a lot of data. I don't know what the holdup is. We really should be pretty close to getting full FDA approval. I did hear that, I do know that both Pfizer and Moderna have applied for full approval, and it's been, I think it's a couple of months now since they've applied for full approval. We were initially hoping they'd do it before school started. Now we're sort of hoping that it would happen sometime in September, but they've got up until December range. So it's sometime between now and December, we're going to see it.
Okay, that's not long. The pop-up sites for, I assume Regeneron on here, that's going to be on patientportalfl.com.
That's why I typed it in. Yes, I saw that there, so I just went ahead and put it. You guys save that, pass that around, get that be widespread. If there's glitches on the website, just be patient. We're setting this up really quick. We already have multiple sites. The one we put in Broward is already, we can do over 300 people a day, and that one is already so busy. We're going to build a second one in Broward. So we're finally getting the word out. And it's good. It's going to save a lot of lives. It's going to prevent a lot of hospitalizations. So definitely keep that. This is the most important treatment we've got. It's proven in 2 different randomized control studies to protect against death and protect against infection for people who've been exposed but who are unvaccinated. So you definitely want to keep that in your back pocket. Give it to your friends, family, etc. Free, totally free.
So that brings to the next question. So I know we have the vulnerable population for Regeneron, and is anyone eligible to get Regeneron, or is it just high risk?
Well, it's supposed to be high risk, but high risk is a very broad term. You could be high risk because of age. You could be high risk because of obesity. You could be high risk because of your ethnicity, because we do see that certain ethnicities do worse. So it's really broad. If you believe you're at high risk, go get this thing. And we've got a questionnaire that you're going to basically attest to what it is you're high risk. It's going to say, do you have high blood pressure? Do you have blah, blah, whatever. It's got a whole bunch of things like, 14, 15 questions on it. And the last question is, if it's not specifically listed, are you at high risk for some other cause? And if the answer is yes, then say yes and just, put whatever it is that makes you think that you're at high risk for. So I really would like you, if you think you're at high risk for one of these reasons, go get it, but don't wait until you're on death's door to get it, because then it doesn't work. You got to get it while it's early. You got to get it while you're not feeling too bad. We really be great, ideally, to get this within 3 to 5 days of testing positive. That should be your goal.
Okay. So the question is, people.
Well, there's no specific deadline. Sorry, Sean, to step on you. There's no specific deadline other than once you're at the point where you need oxygen, you're not a candidate to get it anymore. So don't wait until you're that bad.
So the question is, when someone comes up and said, I walked through the supermarket and somebody sneezed in my face, I think that's a exposure. I want to get Regeneron, and they go through the questionnaire, they say that they are high risk. Would that qualify for the treatment? Because we're going to get that. That's why I ask.
This is good for post-exposure prophylaxis. If this is for unvaccinated people now, right? Correct. So post-exposure prophylaxis, you get exposed, and the definition of exposed is you're within 6 feet of a confirmed COVID case for 15 minutes, and that 15 minutes could be 15 different people for 1 minute, or one person for a continuous 15 minutes within a 24-hour period.
Gotcha. Okay. Looks like 2 more questions. Their minimum age for at-risk personnel for, yes, 12 for that. for the antibody treatment. We said 12 like the vaccine, correct?
That's correct.
All right.
Yeah, you got it. Same as the vaccine, 12 and over.
And does having taken Regeneron for COVID reduce your natural immunity?
I don't know if we have scientifically proven the answer to that question. Theoretically, the answer would be yes. Yeah, for the same reason that we don't give you the vaccine while the Regeneron's in your system, because the way you develop immunity is that you got all these viruses with the spike protein. Your immune cell comes on and grabs onto the spike protein, learns its shape, makes an antibody. So if you got Regeneron there that's covering up all the spike proteins, there's less spike proteins for your immune system to grab onto and learn. So theoretically, yeah, it could dampen your immune response and your natural immunity to it. But I would say that should not be your concern. If you're unvaccinated and you get the disease, you should be worried about the bad outcome you get from the disease. Let's get you over the hump. Let's get you safe. Let's get you recovered, and then go get the darn vaccine. That's the way to go. That's at least that's how I would advise you. And again, full disclosure, I'm fully fine with my patients refusing my medical advice. If you don't want plan A, take plan B. I'm good with that too. But that's what I'm looking at the data. That's what I think you should do.
Okay, it's a great question to answer tonight. If you are vaccinated, do you need to take Regeneron if a confirmed exposure, or wait until you develop disease?
No, definitely don't. Don't do it just because you're exposed. We know a whole lot of folks. You're fully vaccinated, you get exposed, nothing happens to you, right? So don't bother jumping in the line to get Regeneron unless, and even if you get little sniffles. I mean, if you're not at risk, and a lot of the folks on this call, you're young, healthy. I mean, you guys are way healthier than I am. The way you guys are at the gym, I see how you guys are. I mean, I couldn't carry all the equipment you guys carry. You guys are in good shape. So if you get exposed and you're fully vaccinated, you start having a little sniffles, a little headache, and you're not at risk, you don't necessarily need this. But if you're out there and you're like, yeah, I got diabetes, or you're overweight, or whatever the risk factor happens to be, yeah, go get the Regeneron. So you have to kind of weigh whether you're at risk or not. The vaccine, sure. Like I said, I want you to be reassured. The vaccine does a really, really good job at preventing death and hospitalization. And when you look at our hospitals, it's 90% plus of the hospitalizations are unvaccinated people. And 99% of the deaths are unvaccinated people. And when you look at the subset of the vaccinated ones that are in the hospital, or the vaccinated ones that die, these folks, by and large, have a bunch of stuff that put them at risk. So, I don't want you to get too nervous just because you get little sniffles and you're fully vaccinated. That vaccine's still pretty strong protection against the bad stuff. But again, if you got underlying risk factors, that's where the Regeneron comes in and gives you that added safety margin.
Gotcha. Looks like, nope, almost got it. Why are the monoclonal antibodies treatments not recommended for children under 12? What treatments are available for this age group?
Yeah, I'm not 100% sure, but I think it has to do with the physiology of 12 and up is similar to adults. And when you get below that, they get a little funky about approving stuff because you don't want to hurt kids. So the regulatory environment is a whole lot of extra hoops. So that's the best I can tell you. I don't really know for sure because it's really not my field. But that's what the FDA, that's the FDA's job. They approve down to what age and whatnot. But no, there's not. And let me reassure you again, for kids that are young, particularly 10 and under, I mean, it is like lightning strikes when those kids have a bad outcome. It's not to say they never have a bad outcome, but kids, by and large, especially young kids, 10 and under, do really, really well at this. And if you use 18 years old, which already does really good at this, and compare the death rate to an 18-year-old that gets COVID, I mean, you're like 600 times more likely to die if you're above 65 years old compared to an 18-year-old. But if you are less than 10, you're less likely than that 18-year-old to die. And so we are seeing that the kids continue to do well, not 100% of the time, right? We do know that kids can get that multi-system inflammatory in children problem. So, but the antibodies and the vaccines are not yet approved. I know the vaccines they have applied, or I'm not sure they applied, but they've studied in kids and they got some data on using it down to younger kids. So if they haven't applied yet, they should be applying soon for emergency use authorization for the vaccine for younger children.
Gotcha. Okay. it looks like we're at the bottom of the questions. Anybody have anything else? I can unmute anyone, throw it in the comments. You know, Doc, I know you are slammed running around with the governor and doing all this stuff. I really appreciate you taking time to talk to our people here. Again, you're the trusted person in the room. You know, you're definitely one of us. So I appreciate you taking the time here to spend your time. I know you're super, super busy. So
Yeah, well, you guys are my family. You know how it works in the fire service. So yeah, you guys need anything, you send up the question. Anything I can do to help you out. You need to get into one of those Regenerons, whatever it is. You guys let me know. I'm there for you. And so the rest of the guys in our group, Dr. Antevi, Dr. Pepe, Dr. Roach, you name it. Dr. Thoreau and the others. I'm not going to name every single doc in our group because you guys know we have a bunch of them. So you need us. Give us the message. We'll do whatever we can to help you out.
absolutely. Hey, Doc, take a look at the comments. You know, everybody's singing your praises. There's a reason you have Medical Director of the Year. So really, really appreciate it.
Yeah, thanks very much. That was a nice honor. Appreciate it.
Not a problem.
All right,
All right,
guys.
I'm
Stay safe. Have a good night.
I'm going to take this recording and send it out to all of the agencies, and we'll put it on Target Solutions and spread it far and wide. So thank you guys very much, and have a great night. Be safe out there. Take care.
Take care. Bye.